Hi friends, today I'm going to speak about COVID-19 and the role of pulse oximeter. So I'm sure all of you must have seen in the news as well as you must have seen people now binge buying the pulse oximeter. But let us first know, okay, is this pulse oximeter really useful? So before I start that, let us understand how is COVID-19. So COVID-19 basically is a lung disease. It is related to a breathing problem. So it causes some problem pathology in the lung, because of which there occurs breathing issue. And that is where you have the importance of this device. Now I'm nowhere promoting this device, but I want you to smartly use the device, and it should be used by people who really need it. So first of all, who should be using this device? So this has to be used by healthcare workers. When we are working in the hospital seeing COVID-19 patients, we use this pulse oximeter. And by using this pulse oximeter, what we actually do is we measure the oxygen level of the patients who are admitted. Now, like in any other disease, what happens is that oxygen level of less than 90 usually alarms us. But this one has a reading. Okay, let me show you first. This one has got a reading, and it has to be placed into your index finger or any of the finger to get the reading. And the reading might come anywhere from 98, 100%, 97%, anything. But when the reading is less than 90%, it alarms us in any kind of patient. But when it comes to COVID-19, the reading which we get on the pulse oximeter, if it is less than 95%, it alarms us that this patient can have serious complication. We have seen recently that there are people who do not have breathing problem, who have tested positive for COVID-19, and then when we measure their oxygen levels with this oximeter, we find that the oxygen levels are pretty low, like they are like 88, 89%, and the person is comfortable. So this is the time when you actually get to save their lives, because you are early diagnosing that this person will go into lungs failure, which we call as respiratory failure in medicine. And when we have already triaged and seen that this is the patient who is going to go into respiratory failure, we are going to keep an extra watch over this patient. We would probably check his vitals 4 hourly, and if required 2 hourly, and can shift him to a critical care unit if required. With this, the advantage is that because we get to diagnose this patient early, we end up saving his life by actually giving priority to the oxygen supply to this patient, as well as treating the disease before it worsens. So in a pandemic, it is very important to identify who is going to need an extra care, pay extra attention to them, and save their life. So this is not something new. This was initially started in US and Italy, where they went randomly in the areas which had produced many cases, and there they started checking the oxygen levels, and then they found that those people who were completely comfortable but had COVID-19 report positive and had low oxygen level usually required ICU in few days. When they started admitting these patients with low oxygen level and treating them with oxygen before they become breathless, they ended up saving many lives. In Mumbai, our COVID task force used the same concept. What they actually did was they started this pulse oximetry in containment zone, and the most famous containment zone in Mumbai was Dharavi and Worli Koliwara. So in this areas, what we did was that we went in the entire area and we checked this through this pulse oximeter. We checked the oxygen level of all the people residing there, because it was a containment zone. We knew that we are going to expect many cases there. But what we were worried about is those patients who didn't have symptoms but are going to get worse in few days. So in that bargain, when they went around and actively checked oxygen, they could get many people whose oxygen levels were on lower side. And when we actually found out all those groups of patients, we admitted them, and then we started oxygen supply to these patients, and they recovered pretty fast and could be discharged back to the quarantine center and then home, saving lives of people even above 65 years of age. This was the biggest achievement by the COVID task force in this containment zone, and helped us to go ahead with the same idea. But now the thing is that there are so many people talking about this pulse oximeter that people have started binge buying it. I think it is not very fair to binge buy this instrument, because the problem is that if we binge buy this, it is not going to be available to those people who actually need it, like quarantine centers, isolation centers, as well as hospitals who need to check the oxygen supply of the patient. So if you have COVID-19 positive, but you do not have symptoms and doctor has asked you to stay inside the house, then in those cases what you can do is you can check your oxygen levels with this pulse oximeter. And if you record oxygen level of less than 95%, that is the right time when you go and get admitted to the hospital. You insist on getting admitted. Before that, now since the hospital beds are almost getting full, what we are doing is that the mild cases who just have cough which can be managed at home are asked to stay at home. And if their age is less than 60 years, they do not have any comorbidities and they just have fever or cough, we tell them to stay at home and tell them to stay in contact with their physician or general practitioner and measure the oxygen level by this. If at all they see that the fever is not going away or the oxygen level is going less than 95, we insist on these people to get admitted. In this way, we will end up using our hospital beds wisely. It will be available to all those who need it. As well as we will have an advantage that we are going to diagnose early those people who will require an extra attention, and in this way we will end up saving their lives. We'll end up protecting them from the stage where they require ventilator. So this was my idea of taking a lecture on pulse oximeter. My simple message to all of you is that you all don't need to buy this. It is required only for those people who are staying in containment zone and who are not getting inspected. Otherwise, our teams are there who come to the containment zones and see the oxygen levels of all those who are admitted. If someone is there in the quarantine center or isolation center also, they are monitored. Only those patients who are not getting beds to get admitted, staying at home less than 60 years, they should measure and they should buy this pulse oximeter and measure their oxygen level using this. And they should report if there is any abnormality. So my friends, COVID-19 definitely is a disease where respiration is affected. Basically the lungs are affected, but it is also multi-system disease, and we are seeing that there are problems which are connected even to the brain, connected even to the heart. As someone had rightly asked me here, that why is there thrombosis occurring? So you need to understand that it is a disease which is there since last 4 months. Not anyone in this world can tell that they know everything about the disease, because it is something which is new for everyone. Initially, we knew that it was causing lung failure, which we call as ARDS, acute respiratory distress syndrome. But now we have also seen that it is causing a lot of thrombosis, and because of which oxygen level goes down. So in either case, treatment is that they will require oxygen at some stage, especially those who have got comorbidities like diabetes, blood pressure, asthma, COPD, lung disease, chronic lung disease, they will require. Purple Eyes has written very nicely that people order this without knowing what this is. It is very sad, because we are in such a panic situation that we are actually not to be blamed when we are doing this, because when the sanitizers went out of supply, we actually panicked that what will happen. So now when this pulse oximeter became famous and people started talking about it, people thought that, this will also go out of supply, and because of which the price of this thing has also doubled. Unfortunately, there are opportunistic people everywhere. So that is why this will also become short supply. If we just understand that who requires it, we can save this for those who really need it. So it's a very important device, but let us not talk too much, and let us not make everyone apprehensive that if you do not have pulse oximeter, it's like you will have a biggest problem. It is nothing like that. If you do not have a pulse oximeter, you can always contact your family physician, your general physician, anyone who can help you with the device, and then it can be cleaned with a alcohol based sanitizer and can be used for another person. If you're staying in containment zone, there will be people who will be coming to your house and insisting on checking your oxygen level with this machine. Please allow them to do so. Make sure that you wash your hands after that, and they clean this machine with the sanitizer or alcohol based hand rub basically. Okay, so I end this live session. I hope you all got the information and you all enjoyed the session. Thank you. I'll be waiting for any more queries and any more interesting topics you want me to discuss in the next live session. Till then, good night, and don't binge buy anything.